Thank you. Good morning. Madam Premier, Minister Gordon, distinguished guests, board members, staff, physicians. My name is Brian Scumbert. I'm the CEO of Prairie Mountain Health, and it's my great privilege to welcome you all here this morning. Prairie Mountain Health acknowledges that today we are on treaty territory and on the homeland of the Red River Métis Nation. We acknowledge that Manitoba includes the Red River, the original lands and traditional territories of the Anishinaabe, Cree, Dakota, Ojibwe, Oji-Cree, Dene, Inuit, and homelands of the Red River Métis. Prairie Mountain Health respects the treaties that were made on these territories, and we acknowledge the harms and mistakes of the past. We dedicate ourselves to continued collaboration in partnership with First Nations, Métis, and Inuit communities in the spirit of reconciliation and collaboration. I would now like to introduce and welcome Honorable Audrey Gordon, Minister of Health and Seniors Care. Thank you.
Good morning. Thank you to all the distinguished guests for joining us here today. MLA Nesbitt, MLA Wochuk, thank you so very much for taking time out of your constituency schedules to join us. Thank you to Brian Schoenbert for the introduction. I would like to take this opportunity to thank the healthcare providers and staff across the province, including those here at the Dauphin Regional Health Centre. They have worked extremely hard to continue to provide care throughout this difficult time of the pandemic, and to all of you I say a heartfelt thank you. I'm excited to be here for this announcement that I'm sure will improve quality of care for all Manitobans, not only now but well into the future. Investing in healthcare services and communities throughout Manitoba will not only improve the physical health and well-being of Manitobans, but their mental health as well. Our government's investment at Dauphin Regional Health Centre is an investment in the improvement of patient care for people living in the community and in the health region. By improving services in Dauphin, we're supporting the delivery of more healthcare services that are more convenient and are closer to home. This announcement today is a part of Manitoba's Clinical and Preventative Services Plan, which was developed and led by clinical leaders and health system experts from across the province. Detailed planning looked at population growth and community health needs, distance to specialized health services, and the stability and reliability of the province's health workforce. I'm extremely happy to be a part of the exciting time for the Dauphin Regional Health Centre. Thank you all so very much again for joining us today.
For the entire Parkland region. First of all, I want to thank Dr. Trina Matheson, Site Medical Officer of the Dauphin Regional Health Centre, and her staff and leadership, as well as the Dauphin General Hospital Foundation and the team from Prairie Mountain Health for joining us here today. Thank you to all the frontline workers on your teams and your teams who continue to provide the high quality of healthcare services to Manitobans in these challenging times. To you all, we just say a special thank you for all that you do. The COVID-19 pandemic has been and continues to be the most significant challenge of our time. It has impacted the lives and livelihoods of all Manitobans. It has changed the way we work, the way we learn, and how we access the services we need. Our government has a bold vision for better health care that focuses on reduced wait times, improved access, and more services in communities closer to home. And together we are taking another significant step in achieving that goal today. As part of our government's capital commitment for our healthcare system, I am thrilled to announce today a $5 million investment to renovate and expand services at the Dauphin Regional Health Centre. This $5 million renovation project will include the relocation of all endoscopy procedures out of the operating rooms and into a dedicated space where the former emergency department was located. This will allow up to 300 additional endoscopies to be performed right here in the Parkland region each year, freeing up space in operating rooms, which will in turn create opportunity to increase surgical capacity in Dauphin in the near future. This project will also include the relocation of the chemotherapy department to a more modern space. Dauphin is the second largest health center within Prairie Mountain Health, and these renovations will help to enhance the network of programs and services for patients in this part of our province. Construction is expected to begin next year and be completed in 2023. I'm pleased to say that today's announcement will add nearly $30 million in renovations completed at the Dauphin Regional Health Centre in recent years, including the addition of MRI services in 2018, the opening of a new emergency department in 2019, and 12 additional spaces for dialysis patients last year. Today's announcement supports our government's commitment to build, renew, and expand our healthcare sites across the province and improve the quality of care for all Manitobans now and well into the future. As identified in Budget 2021, our historic $812 million investment will support 38 projects in all regions of our province and form the foundation of Manitoba's new provincial clinical network, a system of health services that will improve access and enhance the quality and reliability of care while reducing provincial wait times. Thank you once again for being here today for this very exciting announcement.
Thank you so much, Madam Premier, Minister Gordon. Manitoba's Clinical and Preventative Services Plan has been developed by clinical leaders and health system experts from across the province, of which Prairie Mountain Health and physicians have participated. A major part of the clinical services planning is about providing for a coordinated approach to health services across the province with the aim that patients, clients, and residents will benefit from services closer to home, improved healthcare access, and capacity within our very large, geographically diverse province. Today's announcement is the next step for Dauphin Regional Health Centre's continued role in providing exceptional care to our patients, clients, and residents. Dauphin Regional Health Centre has always been at the forefront to serve the needs of the local communities. The Dauphin Regional Health Centre is our second largest acute care facility within the health region, and it plays a pivotal role in the provision of safe, quality care in this part of the province. Our planning for these expansions of service will be built upon and consistent with the models for care for the province, which will be based on the latest research in care environments to best support recovery, wellness, and family involvement in care. I would now like to introduce Dr. Trina Matheson, our Site Medical Officer for Dauphin Regional Health Centre, to say a few words. Thank you.
Thank you, Premier Stephenson, Minister Gordon, and Mr. Schoonbart. I'm Dr. Trina Matheson, the Site Chief Medical Officer for the Dauphin Regional Health Centre. I'm very excited with the upcoming changes to our previous temporary emergency department. This is a very positive commitment to the Dauphin Regional Health Centre as we continue to strive to provide the best possible care to our patients from Dauphin and our Prairie Mountain Health North region. Along with our previously developed emergency department and special care unit, our facility continues to move forward as a regional health centre, playing a pivotal role in PMH North and our provincial health system. By relocating endoscopy procedures to this space, it will streamline the process for patients and improve the working environment for our dedicated operating room staff. It will also allow our existing operating room to provide access to even more procedures, further benefiting patients. Moving the Dauphin Community Cancer Care Program from the third floor to the main floor will provide more convenient outpatient access while helping to improve their experience during these challenging times. As one of the healthcare professionals who will be working in this new space, I'm very excited by the possibilities. On behalf of the Dauphin Physician Group, we look forward to the completion of this project and to working in the new renovated space. Thank you.
Thank you so much, Dr. Matheson. We've been very fortunate and have had success here at Dauphin Regional Health Centre with a strong physician department complement. We have the Parkland Family Medicine Residency Unit, which has been in operation for almost 30 years now. It has helped recruit and retain doctors, not only for Dauphin, but also for other Prairie Mountain Health facilities and, of course, elsewhere in the province. Dr. Matheson is a graduate of the Parkland Residency Unit, and along with Dr. Kish, who's the current unit director, and their colleagues, they continue to provide strong leadership, excellent mentorship, especially to medical students who continue to come through this program. As well, I want to take this opportunity to acknowledge our staff in Prairie Mountain Health. As we move forward on this exciting path through clinical and preventative services planning, it would have not been possible without the commitment and expertise of our dedicated staff. Our staff have continued to rise to new heights, answer the call of duty, especially during these extremely busy and challenging pandemic times. A sincere thank you to our staff, to our healthcare heroes, for their dedications to patients, clients, and residents we serve here each and every day. This brings us to a close on the formal part of the festivities today. But before we wrap up, I'd like to again take this opportunity to thank Premier Stephenson and Minister Gordon for this very exciting announcement. Thank you very much, and at this time, we'll take some media questions related to the announcement. Thank you.
These 300 extra scans, is that satisfying a local need, or are the steps towards the center of excellence that are going to see patients coming from around the province?
If I may, I'll respond by saying any increase in endoscopy procedures throughout the province is of a benefit. At some point, maybe in the province, we'll have sort of a central intake provincially. But at this time, even this area and PMH can use the additional capacity for endoscopy procedures. And it will benefit us greatly in terms of bringing down our wait times.
And so those scans and the increase in surgeries, what does that mean in terms of staffing?
It will add some staffing to this facility. As you know, we've had some challenges with staffing throughout the region. It's a national issue, but we know that there's opportunities to continue to recruit. The schools have been helping us in terms of even bringing staff and training them in our community. We also have had the announcements of the International Educated Nurses Program, the 400 additional seats, and I mean, there's many things that are now happening that we are pretty confident, we're confident that we're going to be able to staff for all the increases.
How many do we need?
Well, for the endoscopy unit alone, we'll need about 10 additional staff. That's not to mention, though, that we will be actually adding some additional beds at some point as well, and we'll need some staff for that. So it does mean a couple dozen additional staff eventually for the facility.
And are those nurses, doctors, or what combination?
It'll be a combination, and for the endoscopy unit, the bulk of what's needed there will be nurses.
Maybe I should come up with more questions.
Yeah, we can do a photo. Oh, sorry, yes.
Hi, with the recent report about the less surgery happening in the province, what will this mean to help relieve some of that backlog?
Well, first of all, it's going to be, we're going to start next year, so it'll take a little bit. But the province is working very hard to begin to relieve the backlog as soon as possible. So I mean, yes, it will help, but it'll help towards the end of probably that period of time with regards to the procedures that are currently backlogged. Yes, you bet.
Thank you for your question. So this week I was pleased to announce the startup of the Steering Committee and Diagnostic and Surgical Task Force. They have already begun their work and will have a report for Manitobans early in the new year. We stated in the announcement that the plan is not to reduce surgeries, but to increase our capacity to do more surgeries and diagnostic tests. So that is the goal of the task force, and we're here as a government to support them in achieving that goal. As you know, we have invested as a government $50 million, and some of those funds, approximately 9 million, has already been utilized to provide 11,000 different procedures. And so we will continue to support our healthcare workers and our surgeons as we move forward to increase capacity in surgeries in the province.
Perfect, thank you.
Again, thank you very much for coming.